Atrial fibrillation is a very large amount of what we do as heart electricians. It's the most common arrhythmia or abnormal heartbeat, although there are about 3 to 5 million Americans living with atrial fibrillation. So what I first tell patients is, don't panic. However, there are treatments that are worth looking into. Some of them are simple things like blood thinners to help prevent stroke, and some of them are perhaps a little bit more complicated in terms of medicines and procedures that we can do to try and at least reduce, if not eliminate, their atrial fibrillation. St. Luke's has given us a great opportunity to bring new technology to St. Louis, and one of those is a newer technique of how to ablate atrial fibrillation called cryotherapy. These ablations are essentially using either heat or cold energy to try and electrically modify the heart so it's not so overactive. Traditionally, we've used heat energy for a long time. Nowadays, we have a new tool called cryotherapy, and it uses cold energy to achieve the same effects. Some of the upsides are that the procedure is often faster by several hours actually, with essentially the same success rates. And we're very happy to be the first in the area to do cryoablations for atrial fibrillation as a big part of our program. Device-based therapy, and what I mean by that are pacemaker and defibrillator devices, are a substantial chunk of what we do as heart electricians, and they're not always the only option, but it's a really nice treatment option for those who need them. People who get devices often worry about their quality of life, and these devices are absolutely designed to improve and maintain their quality of life. We have devices that will help prevent slow heartbeats in people who are having that. We have devices that will treat your heart if you go into a dangerous or life-threatening heart rhythm. There are even devices that can actually help your heart beat stronger in people who are having heart failure. So we have an array of devices, and we of course tailor what device we talk about based on what troubles the patient is having, and figure out how do we improve their quality of life with devices when needed. These devices are rather self-sufficient, and they definitely don't make you part machine rather than human. This is not like Darth Vader, I promise. And instead, they are really designed to augment how you're feeling and make it better. These devices are, as I mentioned, quite self-sufficient. There's home monitoring that takes place wirelessly. You don't have to do anything to it. It just makes sure that all the devices are doing what they're supposed to. And we typically see you once a year, and hopefully it just fades into the background. You don't even remember that you even have it in there. I was very excited to be invited to come to St. Luke's Hospital. A lot of the cardiologists here were my former mentors that I studied under, and it is a great honor and privilege to work alongside them. It's especially an honor to work with Cleveland Clinic, where several of my mentors are now actually there as well. And we have a wonderful cohesive approach to treating the entire patient, where we communicate, we talk about what the different problems are, and how do we find a solution that is a collaborative approach together.